Hello and welcome to Lyra Nara. If you follow our channel, you might remember that a couple of weeks ago we did a two-part video series on cancer, what causes cancer, and the second part was about anti-cancer supplements. And the response from you was amazing. We got a lot of feedback and also questions. And the consensus was that it's so interesting. We want to know more about anti-cancer supplements. So here you go. In this presentation, we're gonna expand on natural anti-cancer supplements. Without further ado then, let's get started. In the last 15 years, experimental, clinical, as well as epidemiological studies have been accumulating which reveal that vitamins, minerals, and phytonutrients are new classes of compounds with remarkable cancer prophylactic as well as therapeutic effects. So what have those studies revealed? First, that tumor inhibition by immune cytokine modulation and anti-inflammatory mechanisms can be achieved with the supplements. Then that those supplements can stimulate cancer suppression genes. They also inhibit tumor angiogenesis. They stimulate the cellular differentiation and the resultant apoptosis of neoplastic cells. They protect also against excessive oxidative stress, and they suppress free radical damages. They also selectively help proliferate healthy cells while suppressing the mutated cells. They also have antibacterial as well as antiviral and antiparasitic effects. And they can decrease the side effects and the toxicity of chemotherapy and radiation therapy, as well as avoid side effects of surgery, so infections. They also balance hormones and they reduce psychosomatic stress. And to reach the best results, three factors are very important. First, you must customize the supplementation based on the patient's health profile and the type of cancer the person is suffering from. And also the dosage is essential to be customized. And the third important thing is that you have to pay attention to the quality of the supplements. Not all supplements are the same. The following supplements have a positive effect on cancer therapy and prevention, and we're going to talk more in depth in this presentation about each one of those. First, vitamins and minerals, then flavonoids, then essential fatty acids and other fats, glandular supplements, and others. So let's talk in more depth about all of those. And we start with vitamins to prevent and treat cancer. On the right, you can see the classification of vitamins. They are dividable into water-soluble vitamins like B complexes and non-B complexes, and fat-soluble vitamins such as vitamin A, vitamin D, E, and K. And when it comes to the B complexes, you have, as you can see here, energy-releasing vitamins and hemopoietic vitamins and others, etc. This is just for your information, but what we are here really for is to learn about the effects, the actions that certain vitamins have on cancer. So let's talk about this. Vitamin A first. The actions are it's acting anti-carcinogenic and immunostimulating. Specific uses and interactions are that it protects against lung and throat cancer, and you should take about 10,000 to 25,000 units per day. Next up is carotenoids. They are a great antioxidant and they inhibit carcinogenesis. They protect against leukemia, myeloma, and cervical, breast, lung, prostate, pancreatic, throat, as well as colon cancers. The recommended general daily range is 15,000 to 50,000 units per day. Vitamin E, a great antioxidant also, it reduces the cellular lipid peroxidation and stimulates your immune system. It protects against skin, prostate, and colon cancers, and you should take about 200 to 800 units per day. Vitamin C, ascorbate, is also a great antioxidant. It inhibits carcinogen formation. It's also important in collagen synthesis and glutathione activity. It protects against cancers of the lung, larynx, esophagus, stomach, pancreas. It also protects your skin and bones from the effects of radiation therapy. Recommended doses here 500 to 2000 milligrams per day. Vitamin D inhibits and reduces proliferative effects of estrogen in breast cancer and testosterone in prostate cancer. It prevents colon, breast, and prostate cancer, and the recommended doses is 400 to 1000 units per day. Next up is vitamin K in its non-toxic form, of course. It's anti-hemorrhagic, it's a tumor analgesic, and a cancer inhibitor. It fights cancer cells. 5 to 20 milligrams per day is the recommended general daily range. Coenzyme B, also known as pyridoxal 5-phosphate, reduces cell growth, inhibits protein tyrosine kinase, and it prevents melanoma and neuropathy. 50 to 100 milligrams is the general daily range for it. Next up in our list for supplements that help you prevent and treat cancer are very important minerals that are highly recommended. First on the list is folic acid and vitamin B12. It turns cancer genes off. It also improves your appetite and sleep and aids in metabolism or methyl metabolism. It treats cervical dysplasia as well as squamous metaplasia and cancers of the gastrointestinal tract. The general daily range is 400 to 2000 mcg each. Next up, calcium orotate. It recalcifies the bones and inhibits colon cancer. It inhibits bone metastasis. It reduces pain and helps in colon cancer. And here the recommended daily dosage is 100 to 300 milligrams per day. Potassium is next on the list. It provides immune defensive actions and it decreases the cancer risk as well as activating the ATP production. The recommended dose is here 200 to 400 milligrams per day. Magnesium provides immune defensive actions. It's also a natural laxative. Recommended doses here 200 to 600 milligrams per day. Coenzyme Q10 removes toxins from your body, is vital to the body's mitochondrial electron transport system also. It prevents heart disease, is specific for anyone using adriamycin, a chemotherapeutic drug, and cytotoxic anti-cancer agent. Recommended dosage here 100 to 600 milligrams per day. Lipoic acid is a pro-oxidant or an antioxidant. It increases cell efficiency. It's an antitoxin also, has radiation protective properties. It also reduces lactic as well as pyruvic acids. It activates T cell functions and increases the glutathione levels. It provides liver and kidney protection. It's great for immune surveillance. It enhances intercellular glutathione and inhibits oncogene transformation. Recommended doses here for lipoic acid is 200 to 600 milligrams per day. And last but not least on this list is glutathione. It protects the cells against oxidation. It's a detoxifying agent both intracellularly as well as extracellularly. It also induces tumor cell death. It's critical to prevent and treat cancer therefore. Recommended doses 50 to 400 milligrams per day. I also wanted to show you this graph that depicts the 20 most important minerals for human health with all of their positive actions. And you can go through the list, pause the presentation right here and go through the list quietly and patiently. If you are interested, magnesium, calcium, kalium, iron, phosphorus, selenium, copper, mangan, zinc, chromium, all of those are listed here. As you can see, the legend is down below. what positive actions those minerals have. So if you want, pause the presentation right here and have a closer look at all the other positive effects of those 20 minerals for human health besides their anti-carcinogenic actions. But we are here, of course, to concentrate on the minerals and the supplements and the vitamins that help you prevent and treat cancer. So let's continue on with selenium. It's a great antioxidant. It stimulates cellular immunity. It also inhibits lipid peroxidation. It converts hydrogen peroxide to water in your body. It's a great anti-cancer mineral. It protects against skin, breast, colon, throat cancers. It also protects the immune system from the negative effects of chemotherapy. Recommended daily range is 100 to 800 milligrams per day. Molybdenum, next on the list, it's a great detoxifier. It also helps the liver excrete copper, and it inhibits esophageal cancer. 200 to 400 mcg per day recommended. Zinc stimulates the immune system. It also strengthens the cellular immune function. It accelerates healing after surgery and improves appetite, as well as prevents loss of taste. 10 to 50 milligrams per day recommended. Next up is N-acetylcysteine. It helps to synthesize glutathione. It's a great antioxidant, it's anti-carcinogenic, and it also protects your DNA. It provides liver, the heart, and the lung with protection from chemotherapy-induced damages. Recommended dose is 500 to 3000 milligrams per day. Taurine, it's also a great detoxifier of heavy metals. It helps also your liver, kidneys, and heart. It inhibits seizures and regulates blood pressure. Recommended 1000 to 600,000 milligrams per day. Glutamine regulates the protein synthesis. It also removes renal ammonia and maintains immune function. It heals gastric as well as peptic ulcers, and it's an essential nutrient for cells of the small intestine. 2000 to 6000 milligrams recommended. Calcium D-gluconate detoxifies, metabolizes excess estrogen. It inhibits hormonal-driven cancers also. Here it is recommended that you take 1000 to 6000 milligrams per day. Quercetin, next on the list, it has great anti-cancer activity. It's also anti-inflammatory and stabilizes the mast cells, as well as inhibits the mutation of the suppressor p53 gene. It inhibits breast, ovarian, and prostate cancers and works synergistically with many chemotherapies. 1000 to 2000 milligrams per day recommended. Next, in the supplement list that is recommended, we have so-called anthocyanins and the related flavonoids, such as grapeseed, pine bark, hawthorn, and bilberry extracts. They are anti-inflammatory, they are anti-allergic, antiviral, as well as anti-cancer. They protect the heart, the nerves, the vascular system, and they work synergistically with NAC and lipoic acid. 100 to 600 milligrams per day recommended. And last but not least on this list is the catechins, the green tea polyphenols. They are great anti-cancer agents. They induce apoptosis in many cancer lines. They are also antiviral, immunomodulating. They are a great antioxidant. They protect the heart and the liver, and they accelerate the healing after surgery. Recommended here 50 to 2000 milligrams per day. And I would also like to make a note about dosages in general. Dosages, all of the dosages that are noted here are general daily range guidelines. In most cases, the lower dosages are for prevention and the higher ones for treatment. However, individual protocols for treating specific conditions should be supervised by a qualified healthcare professional. And we will finish today's list off with essential fatty acids and enzymes for prevention and treatment of cancer, starting with the omega-3 fatty acids, alpha-linoleic acid, also known as ALA, and eicosapentaenoic acid, also known as EPA and DHA. You can get them the ALA from flaxseed oil, porcelain and hemp oil, and the EPA from fish oils and Eskimo oil. Their actions are they are a source of ALA and EPA. They have anti-tumor effects, also anti-cachexic effects. They inhibit metastasis. They are anti-inflammatory, and they are prostaglandin regulating. ALA, the general daily range that is recommended is 1 to 2 teaspoons, and EPA and DHA 1 to 4 tablespoons. Next we have gamma-linoleic acid, also known as GLA. You can get it from evening primrose oil or borage oil, as well as black currant oil. It suppresses tumor growth and regulates your hormones. 3,000 to 6,000 units per day recommended. Squalene, you can get squalene from shark liver oil, for example. It's useful in cancers of viral origin, such as cervical cancer. It increases the cytotoxicity of many chemotherapeutic drugs, and the recommended dosage here is 1,000 to 3,000 units per day. Next on the list we have alkyl glycerols. You can get them from bone marrow, shark liver oil or mother's milk. It protects the bone marrow during your chemotherapy. It inhibits also white blood cell suppression and helps with low platelet counts. 1,000 to 3,000 units per day recommended. Then we have the medium chain triglycerides. You can get them from coconut and coconut oil. They promote healthy weight gains and they are a source of easily absorbable energy, and they also help you resist opportunistic infections. 1 to 2 tablespoons recommended. Lecithin can be obtained from soybeans, or egg yolks also contain a lot of lecithin. Lecithin lowers serum cholesterol, it reduces platelet aggregation, it reverses psoriasis and helps to excrete toxins and also protects your liver. Recommended dosage here 1 to 2 tablespoons per day. Then we have butyric acid. As the name already suggests, you can get it from butter, also cottage cheese or Parmesan cheese. It's cancer inhibiting, and it's recommended that you take about 2 to 6 tablets of 300 milligrams each per day. Then we have conjugate linoleic acid, also known as CLA. You can find this in dairy products. It's the cancer inhibiting also. It's about 2,000 to 3,000 milligrams per day that is recommended. And with that we come to the recommended enzymes. First on the list, WAB enzyme. It moderates your immune system. It also activates natural killer cells within your body. It's helpful for disorders of the pancreas, for cystic fibrosis, multiple sclerosis, also an useful adjunct to radiation therapy, and it also inhibits metastasis. 2 to 4 tablets per day, 3 to 4 times daily between the meals is recommended. Then we have L-asparaginase. It's anti-inflammatory, it's also immune regulating, fibrinolytic. It helps, very helpful in acute lymphoblastic leukemia and non-lymphoblastic leukemia. Recommended doses here is 500 to 1000 milligrams 3 times per day under supervision. And the last on the list of enzymes here is bromelain. It inhibits metastasis. It also enhances cytotoxic effects of many chemotherapies. It's anti-inflammatory, immune regulating and fibrinolytic. It's helpful in breast and ovarian cancers and also in post-surgical healing. Recommended dosage here 1000 to 6000 milligrams per day. And with all that being said, I hope that you've enjoyed this presentation. If you did so, please do not forget to like, share and subscribe. Also hit the notifications button so you always know when we put a new video out, and this happens weekly, at least one video weekly, all about natural healthcare. If you have any questions about this presentation or you need personal advice, please do not hesitate to contact us. shop@lyranara.com. I'm also gonna post the complete contact information, including our toll-free phone numbers, in the description box below for your convenience. And with that, I would like to close today's presentation and wish you that you stay healthy. Until next time.